Can hepatitis virus cause liver cancer? In this presentation, we will explore an important health topic: whether hepatitis viruses can cause liver cancer, and if so, how this happens. Let's dive in. Can hepatitis virus cause liver cancer? Yes, certain types of hepatitis viruses can increase the risk of developing liver cancer. The type of liver cancer caused by hepatitis viruses is also known as hepatocellular carcinoma, or HCC. It can only be caused by viruses that cause chronic liver disease, chronic hepatitis. Acute hepatitis-causing viruses can't cause liver cancer. This happens because chronic hepatitis eventually leads to liver cirrhosis, which can eventually lead to liver cancer. Which hepatitis virus cause liver cancer? Hepatitis B, HBV, and Hepatitis C, HCV, are major causes of liver cancer globally. This is because these viruses cause chronic hepatitis. In chronic hepatitis, the virus persists in the liver for years, or even a lifetime. Chronic hepatitis leads to long-term inflammation and damage to the liver, thus leading to scarring of the liver, cirrhosis, and a higher chance of mutations in newly formed liver cells that can develop into cancerous tumors. Why hepatitis B and C cause cancer, and hepatitis A not? Hepatitis B and C are more strongly linked to liver cancer than hepatitis A, because hepatitis B and C can cause chronic infections, where the virus persists in the body for years and even a lifetime. This leads to long-term liver damage and scarring of the liver, cirrhosis. This chronic inflammation and damage of the liver increases the risk of developing liver cancer. On the other hand, hepatitis A is usually an acute liver infection, meaning it clears up on its own within a few weeks or months. Thus, it resolves without lasting damage in the liver. Since hepatitis A doesn't cause chronic liver disease, it's not linked to liver cancer development. How does hepatitis B and C cause liver cancer? The chronic inflammation and liver damage caused by hepatitis B and hepatitis C infections create an environment where abnormal cell growth and cancer development are more likely to occur. It occurs in following steps. Chronic inflammation of liver. Hepatitis B and C infections can cause persistent long-term inflammation in the liver, thus leading to chronic liver damage. Cirrhosis formation. This ongoing inflammation can lead to scarring of the liver, cirrhosis, where healthy liver tissue is replaced by scar tissue. Liver cell proliferation. The body tries to repair the damaged liver by producing more liver cells, but this process can also lead to mutations in some of these new cells. Increased risk of liver cancer. When enough mutations accumulate in these liver cells, they can develop into hepatocellular carcinoma, or HCC, the most common type of liver cancer. To conclude, hepatitis B and C are significant global health risks because of their ability to cause chronic infections that may lead to liver cancer over time. Thank you for your attention.